Hello everyone, welcome to my channel. How are you all? Hope you're doing well and spending some quality time for your exam preparation. Okay, let us start with our today's question. The nurse is caring for a client with end-stage liver failure from hepatitis C who is being in the clinic for worsening ascites. The client is treated in the infusion center with intravenous albumin, IV furosemide and oral spironolactone. The following day, the nurse checked the client's lab. Which of the following lab findings is most important for the nurse to communicate to the healthcare provider? So we'll just paraphrase the question. The question scenario is a client who is diagnosed as an end-stage liver failure, and the client is admitted because of some of the complications like worsening ascites. We know that like a big tummy, the fluid is accumulating. So, and the client is on treatment, IV albumin, IV furosemide and oral spironolactone. I hope all of you have an idea of what are the common treatment of a client with the cirrhosis, end-stage liver disease, ascites and all. For the ascites, we'll give lactulose because all the ammonia should come out of the body. It should be in like motion or anything. Then IV furosemide we'll give because the fluid is accumulating. The fluid should be, the excess fluid should be removed out of the body. Otherwise, it may leads to like dilution of hyponatremia. And these are some of the common aspects related to the end-stage liver disease, cirrhosis, ascites and everything. So in this scenario, the nurse, already given the treatment and everything, and she's checking the labs on the next day because we want to verify how the treatment is going. So when she got the lab values, she got out of these four options, she got 4 values. So out of these 4 lab values, which one is most important? So here the clue word is most important, which means that all the values are very important and it should be require some kind of intervention, but out of this 4, one is most important. So we have to pick up that one, and that she should inform to the doctor. We'll see the options. Option 1, albumin 2.5. Option 2, INR 1.4. Option 3, potassium 3. Option 4, sodium 131 milliequivalent per liter. So what do you think? Which is the most important blood value should be immediately informed to the healthcare provider? I hope you all have an idea about some of the normal values of these blood investigations. Albumin in the normal value is like 3.5 to 5.4. And INR, it will be like 1 or 1.1. It should be below 1.1 in a normal healthy person. And a person who is taking any kind of warfarin or anticoagulant, or the therapeutic range of INR will be 2 to 3. Then the potassium, the normal value will be 3.5 to 5.5 or 5.4. The sodium will be 135 to 145. So you now got what is the normal value of these investigations, normal range. So albumin 2.5, which is a low value, so it's called hypoalbuminemia. Do you think hypoalbuminemia is an expected clinical manifestation in a client who is diagnosed with the end-stage liver disease? What do you think? Is it expected? Yes, it is expected clinical manifestation. Why? We know that the client who is on this condition, some issues with the decreased protein synthesis, and the same time it will leads to the low albumin level, because the liver is the main organ behind this mechanism of these actions. So what will happen? The hypoalbuminemia will be an expected clinical manifestation, and it is expected only the client is on treatment. Client is receiving IV albumin infusion. So that is not something immediately we should inform to the healthcare provider. What they will think, already the client is treatment and we are checking how the treatment, how the albumin is sufficient, or whether the patient is okay or not. So that one we will remove it. The second option is INR 1.4. Okay, so it is more than 1.1 and it is a little bit higher range. But what do you think? Yes, when the patient who is diagnosed with the end-stage liver disease or cirrhosis, there are chances prolonged prothrombin time, elevated INR. Why? Because this is some of the issues related to the coagulation factor production and all. So that is also expected. And one more thing, that this is not dangerously high. So we can avoid the option 2 INR 1.4, or we will just keep it for as a second priority intervention. Then third option is potassium. Fourth option is sodium 131 milliequivalent per liter. Okay, 131. Okay, it's compared to the normal range, it is low level. We already said that there are chances dilution hyponatremia, and the client may end up with the low level of sodium or hyponatremia. So if 131 it's not dangerously or not too much low, a little bit low, this can be treated. We'll keep it for the next priority. So the next option, the option 3, is at potassium 3.0 milliequivalent per liter. So what do you mean? What is coming to your mind? Potassium is very important whenever we are thinking about our heart, ECG and all. We know that whenever there is a hypokalemia, especially client with diagnosed with end-stage liver disease, what will happen? If it is not treated immediately, it may end up with some dangerous arrhythmias. And another problem, that one of the complications of end-stage liver disease, that hepatic encephalopathy. So when this hepatic encephalopathy will develop, it could be because of the increased accumulation of ammonia, or the ammonia is not excreting from the body, and that is one of the main cause of hepatic encephalopathy. And another some of the supporting things, that hypokalemia. Whenever there is hypokalemia, there are chances of increased there are chances to end up with the hepatic encephalopathy. The increased chances are there. So compared to all these other 3 options, the low potassium level or hypokalemia, it may lead to dangerous arrhythmias, and it may lead to hepatic encephalopathy. These are 2 main complications which require immediate intervention. So our answer for this question is option 3, potassium. The potassium, it's compared to the normal value, it's a bit too low. And even though the potassium is little bit low also, the cardiac changes, ECG changes will be happening very immediately. That's why we are giving priority in this question. That's why we are considering potassium is the most important abnormal value out of this 4 option, and it should be immediately informed to the healthcare provider. I hope you got an idea, and there are some extra points related to this end-stage liver disease. Especially whenever we study, we have to understand some of the liver dysfunction and connection with the lab values, the protein synthesis, and as we said that it may lead to low serum albumin and detoxification of ammonia, which means increased level of ammonia in the blood, that will leads to high serum ammonia and hepatic encephalopathy. Then coagulation factor production issues, and that will leads to elevated INR and prothrombin time. Then some other issues like hepatic, whenever there is a damage in the liver cells, it will lead to elevated AST and ALT. So this is just for an understanding. So I hope you understand this question, and it will help you to tackle some of the questions related to this particular condition. So bye for now. We'll discuss another question in the next video.